Thank you for joining us tonight. State health officials say we're not out of the woods yet with COVID-19, but there are some signs of improvement. Courtney Ann Jackson has the latest.
State Health Officer Dr. Thomas Dobbs says we're still in the thick of the Delta surge, but there is some encouraging news on the COVID-19 front in Mississippi.
Of almost 1.5 million people, almost half of the state has received at least one dose. But we don't have near enough people in the state who are immune, either because of natural infection or because of vaccination, to keep us from having additional surges or to keep us from having additional outbreaks.
This chart shows the hospitalizations over time. You can see the numbers started dropping by late last month, but the number of patients in the ICU remains higher than previous surges in the pandemic.
The bed capacity for ICU space is effectively zero still in the state of Mississippi.
And pregnant women are the latest focus of warnings from these health leaders.
Currently, we're investigating 8 reports of pregnant women who have died within the past several weeks, all of whom are unvaccinated. We do know that COVID is especially problematic and dangerous for pregnant women, but we also know it can be deadly for the baby in the womb.
Meanwhile, another pediatric death recorded this week, a reminder that the Delta variant is hitting hard, regardless of age.
An additional pediatric death. This is in a child less than a year of age. That brings us up to 7 pediatric deaths that have been reported so far during this pandemic.
Courtney Ann Jackson, WCBI News.
There were several questions asked about the new variant that's been making national headlines. So far, 4 cases have been identified in Mississippi since May, but Delta is still the predominant strain.